Dr. Shailaja Chandra, if you can come in over here. Prime Minister Modi has tweeted that India could break the chain in the spread of the virus. We just heard Ms. Reddy say that, perhaps this can be contained. Your first thoughts, because a week ago we were reporting cases being reported in the 50s, low 50s. Now we are in the low 80s, and we've seen 2 deaths, including 1 in the capital.
I would put it in 2 baskets. One is the good basket. India has responded very quickly and very efficiently very early on. The kind of leadership that one has seen in the Health Ministry and the Prime Minister's office, I've been following it up on Twitter, I've been following it up by asking people. I am really very proud that this country was among the first to stop foreigners from coming in. Visas were cancelled, and I talked to perhaps the director emergency.
A huge step.
Sorry?
A huge step.
A huge step, because this means your relatives can't come here, you can't go there if they happen to be NRIs or holding these cards, OCI cards or whatever. It means that my son can't come here if I fall sick. Fine.
Yes.
I can't go there if I want to look after them, because they are also quite susceptible. But look at the larger picture. What does it mean? You're putting your citizens' health, your citizens' safety above everything to do with commerce, industry, tourism, international cricket, all kinds of things which we have been accustomed to, because you think health of your citizens comes above everything, trade, industry. That is a huge step. Having said that, I would just like to give you 2 anecdotes. One is that I spoke to the airport health officer in Delhi. I spoke to the director emergency medical relief, because I've been in the health ministry. I know how the system works right from the time plague took place in 1994. The fact that you have this monitored at a very high level makes all the difference. You get heard, decisions get taken, and you don't have to look over your shoulder and send files. It happens in moments. That's a very big thing. The APHO was so convincing, the way he said, this was several days ago that I talked to him. You are screening not just the people who appear to be at risk, but 3 rows behind, 3 rows in front. That's a very big thing to be doing according to the manifestos, and using the integrated disease surveillance program of the government, which was set up in 2010 with World Bank assistance. That is when these other diseases were spreading, but it's come in very handy. Now, on those scores, in that basket, I think India is doing extremely well. You couldn't do better for a country which is really the size of, it is a subcontinent. France is the size of Tamil Nadu, Bihar is the size of Germany. We're not talking about states, we're talking about countries, and we are managing that. 2 things which worry me a lot is, if state governments do not also respond, and they have to respond to the WHO guidelines, WHO Geneva, and not make up their own, you might say, theories. If they follow the WHO guidelines, they would be doing the right thing, but it is more than possible that some would be a bit casual or a bit slow in doing this. Second thing that worries me, and this I hope your viewers are listening, I am not blaming the public, please don't misunderstand me, but there is a sense of entitlement among most educated Indians. Hamara kuch nahi hona hai. And to hell with it, I'm not going to wear a mask even if I'm putting somebody else at risk. I am going to do as I please. I'm going to, like this woman who just went away from Bangalore to Agra and told a whole heap of lies, and her parents or whatever it is enabled her to do that. This is really, really irresponsible. And I must say that our population, our people who take decisions in the homes, be their fathers, fathers-in-law, be their mothers, be their actual, you might say, householders, they have to look at the public good and not only their own good.
Absolutely. So, and I can see both our doctors here in studio are nodding in agreement with you, Shailaja Chandra. But I want to first touch upon what you said, the WHO guidelines must be followed, because the WHO guidelines is emphasizing on testing, and testing is essential for identifying people who've been infected and for understanding the true scope of the outbreak. Now, the WHO is insisting and urging, and again today they have done so, that you must increase testing among other measures to contain the COVID-19. Shailaja Chandra, it's not yet a community infection, but India is a huge country of 1.3 billion. Are we underprepared? We have a lot of people living in very close, compact spaces. Social, distancing may not really work if you're living in a slum. Is it possible that we could magically skip the kind of numbers that we're seeing in other countries?
No, I think that it will be foolhardy to say that we're going to skip it. It is going to happen, but the containment can be the only way that you can reduce the impact. You're very right. At the community level, particularly once it flares up in a community, then there is, you know, if there's one death case, it means everybody that person has met over the last 14 days, going on to all those who are carriers. Children are the biggest carriers of this. They don't themselves succumb, but they are carriers. Now, how many people are you going to screen? How many people are you going to look on as suspects? It's true that we are trying in India to look for kits which would be able to do the testing in less time. I think Indian people, Indian industry is working on it. I heard about it yesterday. That is the only way that you make the testing time much, much shorter. If it is short, then you would be able to do this testing in the community, maybe do some randomized testing in congested areas. But this is very, very worrying, because the way our communities are placed and the kind of, you might say, myths that are going on, despite copious advertising, despite so many advisories going out in the newspapers, on television, even then people are talking things which are completely mythical. So that is very worrying, and obviously levels of education and literacy being what they are, there is a tendency to just, treat it as though it is, oh, ye pehle bhi SARS bhi hua tha, wo bhi MERS bhi hua tha, kuch bhi hua tha. It doesn't get down to us. India is able to overcome. That kind of complacency is very, very worrying. And that is the only place where governments have to reach out to communities. That is why I would say that whether it is a district magistrate who should be given powers to recruit and employ anybody in the government to do this house-to-house checking, just to check on symptoms. We have done it for polio when we had to do it. India does know how to work at the community level. The time has come when that would have to start.
Again.